Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. It was just last month when LeBron James's 18-year-old son, Bronny, suffered a cardiac arrest during basketball practice at the University of Southern California. Back in January, 24-year-old Damar Hamlin of the Buffalo Bills suffered a cardiac arrest after completing a tackle during Monday Night Football. Both are recovering, but you may be surprised to know that sudden cardiac arrest, or SCA, is the leading cause of death in young athletes. How common is sudden cardiac arrest in young athletes? Who's at risk? We'll answer those questions and more as we're talking with Dr. George Sokos, Director of Advanced Heart Failure at the WVU Heart and Vascular Institute. Welcome, Dr. Sokos, to Tuesday Talks.
Thanks for having me.
It's great to have you here. Now, if you have any questions about sudden cardiac arrest, just enter them in the comments section below and we'll try to answer them live. Okay, this is a hot topic right now.
It is.
It is.
You get some, higher name athletes out there and you start getting a lot of questions. I know we talk about it in my clinic, oftentimes with family members when they're talking about their kids or grandkids or whatever. And yeah, it definitely happens, and we obviously have some patients as well that it's happened to in our clinics. So
okay, so let's start with exactly what is sudden cardiac arrest.
Yeah, typically sudden cardiac arrest comes from an arrhythmia. Okay, so the heart will beat extremely fast or have ventricular tachycardia or what we call ventricular fibrillation, which the heart's unable to pump blood. It's pumping so fast electrically that it's unable to pump blood out to the body, and you can typically die from that.
Wow.
Which is why I know we'll maybe talk a little bit more about this, but we recommend. And you'll see this at your churches, at your schools, the automatic external defibrillators or AEDs. You'll see them everywhere, and they should be everywhere. And most schools, if not all schools, now have them not only in the school, but in their athletic facilities and those sorts of things. So you place that on, everybody's seen on in their TV shows where people have the paddles and they shock people. That's what those devices do, but they're smarter than just shocking. They look at the heart and they determine if the rhythm is the heart rhythm is abnormal, and whether or not giving a shock is going to be beneficial or not.
And using one of those AEDs, I mean, it tells you exactly what to do.
Anybody can do it. All you have to do is listen.
That's it. You just listen.
If you ask my wife, I have a hard time with it, but all you have to do is listen. But it really is. It's extremely simple and effective. I mean, they are everywhere, and they're usually very easy to spot. And
can an AED be the difference
yes.
in life or death if you have sudden cardiac arrest?
Yes, absolutely. If you look, there's several studies out there looking at who can survive a cardiac arrest, right? So you'd think that if your heart does that, how do you survive that?
Yeah.
So there's a much higher likelihood of survival if it's a witnessed cardiac arrest versus, so if I'm here, or you don't even have to be, as long as you're there and you see it, and there's a bystander, you call 911, you get the AED out, and what does it look like? So people just drop to the ground and they're unconscious. So you have no idea what's going on with them. Could they have just passed out? So you want to feel for a pulse and all these things. But if it's a witnessed cardiac arrest, there's about a 50% chance that people can survive. It really kind of depends on the scenario. Obviously, that's kind of that's a general statement.
Yeah.
Because it depends on why it happened. Okay.
Right.
And it's different based on. We're talking about young athletes today, but if you look at all the data and information out there, the difference in age really determines what the cause of it is. People who are older, and as I get older, I don't feel like this is older, but if you're older than 35, the most likely scenario is it's from coronary artery disease or having a heart attack. That can cause a cardiac arrest like that.
Right.
But in younger patients, that's not the case.
Okay. So how common is sudden cardiac arrest in young athletes?
It's still very rare, honestly. It's and the numbers vary depending on whether you're looking in the United States or Europe, and it's like 0.24 per 100,000 people. Yeah. So it's not that common, but it only takes one, and if it's your kid, that's common enough, right? So it can be scary when you see it happen, particularly in a young, healthy athlete who's like well-tuned. You look at Bronny James.
Yes.
I mean, that guy's as fine-tuned as you can be, and he dropped, right?
Yeah.
But he was also witnessed, and he survived. Again, that goes to my point is, these folks, we say they're lucky, but when you're in front of someone, your chances of survival are much higher.
Now, we mentioned Bronny James and Damar Hamlin.
Two totally different scenarios, right?
Yeah. What was the difference there?
So Damar Hamlin, what we think happened is he got hit in the chest just at the right time in the what we call the cardiac cycle. Every heartbeat you have is there's electricity that's going through the heart, and we think, again, this is what we don't know this for sure, but from everything we can gather, that he got hit in the chest at just the right time during the electrical portion where it stunned his heart to stop, and that's why he had a cardiac arrest. Versus Bronny James, he was active and no one hit him, and he just dropped. And again, I don't know the details of all his what happened to him, but I would suspect that he had an arrhythmia that's why he went down like that. And that's what the information that we have is out there about him.
Okay.
But totally different scenarios.
Yeah.
Both young, healthy athletes.
That's what's so scary.
Yeah. One thing I will say is it is much more common in black young men. In this country, it seems to be like that demographic seems to be a higher demographic. Doesn't mean it can't happen to anybody else. It just means that when we look at things, that's what we've seen. And if you look at some of the next question, and I think I'd be thinking if I'm out there is, why does this even happen?
Yeah.
All right. So in younger folks, there's a lot of reasons that we look for, genetic abnormalities, something we call, I'm going to use a technical term here, but I don't expect to. It's called a channelopathy, or it means like something abnormal in the electrical conduction system within the heart that's genetically not right. And we can screen for that with genetic testing in certain folks, and we will. If some young person has that, we'll screen for it in their siblings and other family members, and we do that at WVU. Or what we call hypertrophic cardiomyopathy. That means an abnormal thickening of the heart walls, and that can cause abnormal heart rhythms and can cause people to pass out. And that can be. There's lots of ways. We have a treatment center for hypertrophic cardiomyopathy. Actually, one of my partners, Dr. Bianco, runs that, and. So it's actually really cool because we have newer treatments with medications for this. Yeah. And if someone's more susceptible to sudden cardiac death with those kind of things, we can put a defibrillator in for prevention ahead of time. So it depends on when you find it and if there's a family history about things. So really, the differences in how it can happen are pretty important. I will say this: the majority of the time, we don't know a reason. Right. We don't find a reason, which was it's the case, unfortunately, probably 40% of the time we don't find a reason.
Wow. Yeah, that's got to be frustrating.
Yeah.
But
it really kind of depends. There's different studies out there in different registries. So there's one in Europe, there's one here, in London and UK. So you look, there's all these different recommendations, and we're not uniform in the United States versus elsewhere for how do we screen for this? I think that's probably the next question. Yeah,
that was my next question. I mean, how do we screen for something like this? Should we be screening? Or is there something we're not doing that we should be doing? So the recommendation at this point in the U.S. is that we do every athlete, and I think everybody who has a child that goes to play sports, you have to have a screening physical, right? So that's physical exam, but you should be also taking a history. People should be talking about, is there anybody in your family who's had sudden cardiac death or died suddenly, and kind of dig more into that. That's really important because even if you're not sure how someone died, then that may warrant some other testing. Right. That's different, and if you look in Europe, soccer's, or they call in football, soccer there, but they call football. Right. That's where they do most of their screening. Everybody gets an EKG in Europe. That's what their recommendation. That's the standard. That's their standard recommendation. But not here in the U.S. Not here. Think we should change that? I lean towards that, but that's it. I think that's a huge question. That's a public health thing that we should talk about.
I think it's absolutely in the realm of discussion, and there is discussion on some of the guideline committees about should we do that or not. Right now, the answer is no, and there's lots of reasons that not. Is it cost effective to do that? Do we get abnormal EKGs that we track down? Because it can also, you have to think about it the other way. If you find something that doesn't mean anything, but you're not sure, do you not let someone play? So there's consequences the other way too. When you do too much screening, you can find things that you're not sure what they mean.
Yeah.
And then you can keep a child out of playing athletics when they don't need to be.
Yeah. Now, but I'm sure there's some parents out there that are thinking, should I not let my son play football, a high impact sport? I mean, is that a cause of sudden cardiac arrest, like the intensity of a sport or overworking your body?
So higher intensity sport, the chances of sudden cardiac death are more common in higher intensity sports because you're working harder. So you are, but it doesn't mean you can't play that. It just means that if you're prone to it, it's going to happen. It's more likely to happen if you're doing a high intensity activity. But I would say, that's where you talk to your doctor about, okay, do we have any reasons to be worried? Is there anything on the physical exam? Is there any other family things? And that's where that discussion has to really come into play.
Okay. So know your family history and talk to your doctor about it.
Yeah, absolutely. Okay. And I think there's nothing that hurts to ask, does my son or daughter need an EKG? I don't think that's a good question to ask. But again, flip side of that is, what are you going to do with it if something's not just quite
right? Not right. Yeah.
But I will say this, that's why we have a team of experts. We have electrophysiologists at both the adult and pediatric centers here, in the HVI and Heart and Vascular Institute. So if something's not quite right, that's where the experts come in to help us with that. I typically get involved when if someone has a sudden cardiac event, I get involved afterwards. As do most people. I mean,
sure.
We really lean heavily on our electrophysiologists. Dr. Schwartzman is one of our electrophysiologists that leads our team in the adult world, and we look to lean on them for screening purposes. So if they look at the EKG, we all as cardiologists know how to look at an EKG, but there are significant subtleties to these kind of things that an electrophysiologist can really lead more guidance to.
So, what are the signs that someone may be experiencing sudden cardiac arrest?
I wish there was, prelim signs. Typically, most things happen that people get. Sometimes they'll be a little bit of what we call a prodrome. They'll get a little lightheaded and then go down. Sometimes they just go down, or it just kind of depends on what's going on. So, but I will say, if someone's exercising extremely hard and they're having any kind of symptoms, like they feel like they're going to pass out, then that's reason enough to talk to your doctor about it. I mean, it's not going to hurt to talk to say, hey, I felt lightheaded. Could be just, and these are things that can lead to that we know are predisposing factors, so to speak, is dehydration and electrolyte abnormalities. So we really encourage everybody, when you're working out hard and you're high intensity sports, to maintain your hydration, drink enough water, drink enough Gatorade, all those sorts of things. Try to avoid getting too overheated, and that's why coaches, old school days, it didn't matter. You're out in the heat,
terrible.
They beat you down, and it didn't matter, right? Now we're really much more cognizant of that, and no one's trying to be, the toughest person out there for these kinds of things. Doesn't mean you don't work hard. Doesn't mean you don't be in shape. It just means that you be smart.
Yeah. So, I mean, those are those ways to prevent?
Those help.
I mean, is there anything else we should be doing to prevent this from happening? No,
and those are the biggest things you can do. And again, know your history. Again, more, oftentimes we don't find a reason as to why this happens if someone has sudden cardiac death. So I don't want to say that we're that good. We try. We do all our testing. We do echocardiograms. We do genetic testing. We do everything that we can do to try to figure out why did this happen. But oftentimes we don't. I'll tell you what's very difficult too is, well-tuned athletes have thicker hearts. It's just a thing that we see it. We see it, and sometimes it can be difficult to distinguish that. We call the quote-unquote athlete's heart from a hypertrophic cardiomyopathy, because that's a thickened heart too.
Oh, wow.
So, but we can do tests like cardiac MRI that really help us determine the differences between the two.
What should we do if we think somebody is experiencing sudden cardiac arrest? What's the first thing we should do?
If someone call 911. If someone's having call 911, get an AED if it's around, and if you don't feel pulse, obviously you start BCLS protocol or ACLS if someone's there that knows that, and that means CPR, those kinds of things. If you don't feel things, so that's why everybody has a trainer who's real. In our hopefully in our sports, there's a trainer there that can do this. But depending on if you're super young, that's not unlikely to be the case. Youth sports in general, but any bystander can check for a pulse and do CPR if you're trained in it.
Yeah. How likely is it that you'll recover from a sudden cardiac arrest if you're a young athlete?
So, looking at all comers, if like I said earlier, if it's witnessed, it's about a 50% chance that you can survive. Really, kind of depends on what's causing it. Again, unwitnessed, if someone's drops, we don't know how long they've been down for, those sorts of things. So that's why their survival is really, really low. So it really kind of depends on the cause, number one, and who's there to help, number two. Again, you look at Damar Hamlin, we had everybody in the world at that stadium, right?
Yeah.
He had all the right people. Same with Bronny James, all the right people. But I'll say, I have a patient who is an athlete locally that didn't have all the people, but someone was there that knew how to do CPR and saved her life.
Thank goodness.
So it's extremely important. I'm not saying you should be scared not to work out alone. I don't mean that, but it's always if you're in a facility or at least there's someone else around.
Yes.
There's a better chance of survival, right? But I don't want to. I would say it's still. I think we're talking about this, and it's scary to hear all this, but it's still a very, very rare.
Very rare. Very rare.
So we're talking about it because it's in the public, and it happens, and you should always be prepared for these kind of things, and so that's why it's important to discuss it.
Well, if you do survive a sudden cardiac arrest, how long does it take to recover?
Well, it really depends. It depends on how long it took to get them back. From being.
I didn't expect Damar Hamlin to be playing.
Yeah. If you well, and again, it really depends on. His scenario is very odd.
Yeah.
The likelihood of that happening is
typical.
extremely. That's lower than typical sudden cardiac death. Because it was just he had to get hit just at the right time.
Wow.
Extremely abnormal.
Yeah.
Unusual. I wouldn't say abnormal. Extremely unusual.
Yeah.
But I don't think there's a direct timeline you can say how long does it take to recover because it's really kind of variable.
Yeah.
Some people it takes them a long time just to wake up. They can be on a ventilator. You can be on other kinds of life support, and it can take an extended amount of time just to learn how to function again. It depends on how affected the brain can be because when you have sudden cardiac death, you're not getting blood flow to your brain, so that can affect your ability to think and how you recover from that, and sometimes how you can be able to walk and all those sorts of things.
Yeah.
So it can be, or you come back just like that and you don't have anything.
Yeah.
So it really it's so variable.
Okay. So can you talk a little bit about the team of experts that we have at the WVU Heart and Vascular Institute and how they're not only national leaders, but they're world leaders in heart care?
Sure. Yeah, we have several members, not just dealing with sudden cardiac death. I talked about our electrophysiology team, but we have our advanced heart failure team that I'm a part of, and I spoke about Dr. Bianco, who's runs our hypertrophic cardiomyopathy center. We have Dr. Way, who does surgery on some of those folks, and we have interventional cardiologists who participate. So if someone has hypertrophic cardiomyopathy and a thickened heart muscle, we can shave away part of that muscle to alleviate some of the symptoms. So that can be surgically or through a cath lab.
That's right here in West Virginia.
Yeah.
You don't have to leave the state.
You don't. Mm-hmm. You don't. We are very proud to have, a whole significant amount of faculty who have expertise in these areas, and really anything. We do transplants. We do any kind of device that you do. We're involved in studies that are cutting edge from around the world that many other centers are not involved in. So we're really lucky and fortunate to be a part of that.
So before we go, I want you to tell me what's the most important thing you want our viewers to know about sudden cardiac arrest in young athletes.
I would say, please have your children screened, or or if you're a young athlete yourself, please have yourself screened. Talk to your doctor. Talk about, make sure you know your family history. Talk to your family about your family history, because that's really important. And if you have any concerns, that's the time to talk to it. You can get further testing if needed. And it never hurts to come see someone.
Right.
We're not going to say, oh my God, why'd you come here? We're going to say, I'm glad you came. Nothing's wrong. Go after it. Right.
Knowledge is power.
Go after your dream of being an athlete. Because everybody has high aspirations for what they want to do. Some people don't want to achieve high levels. Some people just want to play for fun.
Right.
But you still want to, I know me, you still want to be the best at what you're doing, right?
Right.
So,
right. All right. Well, thank you so much for sharing all this really interesting and important information today.
Absolutely. Thanks for having me.
All right. Great. Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about sudden cardiac arrest and other heart issues, visit wvumedicine.org/heart. And join us on Tuesday Talks on August 22nd, when we'll talk about social media and mental health with Dr. Jonathan Pearl, a clinical psychologist with the WVU Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Dr. Sokos and everyone at WVU Medicine, thanks for joining us and have a great day.